That's a good idea. Welcome. This is the Board of Health meeting, and we'll call this meeting to order at 10:02. Thank you for coming. And today we're continuing our interviews for 3 board positions. When 3 people, Mary Jane, Lindy, and I, our terms were up. So we are looking for 3 new people. The Board of Health will do these interviews today, and it's a long day today. We have a lot of interviews. We might go till 2:30 or 3 p.m. this afternoon. There'll be a lunch break from about 12 to 1. After these interviews, the Board of Health next week at the regular meeting, which is Tuesday, the 10th, at 10 o'clock, sorry. The Board of Health will then vote on a recommendation of the 3 candidates to the Board of Commissioners. The Board of Commissioners is the one who decides and appoints the members, not the Board of Health. So that recommendation will go to the Commissioners. The Commissioners will make their decision. And then the September meeting, at the end of the month, we will swear in the members that were appointed and hopefully continue on to business, back to regular business. So I guess we'll just go right into it. Our first interview today is with Timothy Randall. Well, thank you. Each candidate will have 20 minutes to discuss if needed, and we'll try and keep it moving, and the board members will be able to ask questions. There was lots of questions that are already asked in the applications. These were standard questions for everybody who applied. So thank you very much for coming, and we welcome you.
Thank you.
Commissioner Mortensen.
Good morning. I always enjoy talking to doctors. I learn something new all the time, and that is a good thing. The Board of Health should be a forward-looking organization, and I have a forward-looking question for you. AI is a very interesting technology. How do you see that playing into, into, into the public health arena?
Yeah, one of the challenges of health, medicine, but public health as well is, there's so much information being published and being broadcast so frequently. It's a fire hose of information. And
Could
part
you,
of
is your green light on and,
the green light's on.
okay, if you come closer to
Okay.
the microphone. then, please.
It's a fire hose of information. And you can literally spend all day looking at information, at studies, trying to decide what's relevant for the questions. And, one of the hopeful benefits of improved information processing, AI would be one of those components, is to help be able to refine searches, be able to help define relevancy, and allow us to focus then on, how does that relevant information inform us to make decisions about our needs here in Cowlitz County and in our communities.
Okay, I said I could ask forever questions, but I have some colleagues that would
Yeah.
like to ask questions too.
Weber?
Good morning.
Good morning, Dr. Randall. Thank you so much for applying. I noticed that you're a medical director at local nursing homes,
Yes.
and I'm curious about what you have, how you would describe what we've learned with the pandemic response, because that's certainly, it impacted nursing homes differently than other areas.
Gosh, some days I still feel like the issue of infectious disease has not gone away. What we learned what I learned with COVID is that we need to be very mindful of the multiple needs of the people we take care of in our community. So, I still have masks and gowns that I have that I use when appropriate. If I know somebody's at high risk, if I know somebody is at high risk, I will be appropriate in trying to decide what is it I need to do to protect them and to protect others. What's the appropriate intervention in a nursing home? Is telling people they have to stay in their rooms 24/7 for 3 months while we don't know what's going on, a right answer or a wrong answer. Some of those things you don't know until after the folks who are processing that information have a chance to find out. I think what I've learned is that we need to remain open, flexible. We need to listen to not only the experts, but we need to listen to the needs of our residents, in my case, my patients, and as their needs change, because it's not just the infection, it's the consequences. In the nursing homes, it was social isolation. In the nursing homes, it was multiple people with high-risk illnesses who arguably, if they had another illness tacked on top, would be at imminent risk of severe decline, right? And so you balanced all those needs. Some days it felt fairly onerous, and then other days it felt like it was a success. And I think the take home is that while we have broad policies that are informed by science and really need to be implemented, they need to be implemented in considered ways, and they need to be implemented with empathy and care, because it's that empathy and that care and that personal touch that makes a difference in our policies.
Thank you.
May I ask a question? How would you feel if you see that there is a doubt in your mind as to how medical treatment is being done, coming from the governmental requirements and so forth? How do you deal with that in your practice over the years, as well as through COVID? If you saw that it didn't fit what your common sense showed, or that it didn't sound right, how did you deal with that incongruity with your feelings and what other people that are the experts tell you or have told you?
That's a very broad, yeah, and it always depends on the specifics, right? I mean, if we're referring to recent history, there are broad diversity of opinions about what people thought was appropriate, not appropriate, what they thought the experts were wrong with and without. Again, those come down to individual cases. You know, in an exam room, it comes down to assessing a person's values and their goals for their health care and being able to say, well, this is what I'm hearing is the best data. This is what I'm hearing is less good data. Here are risks, benefits. In the area of public policy, if people were asking me, I would do my best to inform them with what I think is the most reliable, consistent data and what I think is data that still needs either further investigation or I would say, you know, I think this is woo-ha and here is specifically why. And here are the limitations in my assessment. You know, very often my job is to help people understand where they're at so they can make better decisions for themselves. I have patients who make decisions. I work for companies who make decisions that I don't always agree with, but I make sure that I have shared that in a fair and open-minded way.
Mhm. So do you take common sense into, does it go into play though, if you see something that's clearly not right? Do you feel like you could stand up and say, that doesn't make sense? Because that's been very difficult for the medical community to do against the CDC and the governmental policy. So it's,
Yeah.
that's a tough question, I know.
So when it comes to issues like, and we'll reference nursing homes, does it make sense when we have information that our patients stand a 1 in 5 chance of dying if they get an illness that we have no treatment for and we don't understand very early in a crisis?
Mhm.
Does it make sense to tell people they need to stay in their rooms and develop other psychological, social issues that complicate and make their lives worse? The answer is, it's a hard decision. And what do you do if that's what the data seems to do? You try to find ways to mitigate it that are safe. Try to find ways to listen to those families. There are times when you make those decisions and nobody's going to go home happy, and yet you try to find compromises that says we're listening to everybody. You know, that sounds very evasive, but
It's tough.
absent the
question.
particulars, you know,
Okay, thank you.
yeah.
Thank you for coming, Dr. Randall, for interviewing today. The CDC has a popular television commercial that's on almost nightly that states exactly all people over the age of 6 months should be vaccinated. The key word is all right there. What about the people who are allergic to the ingredients of the vaccine? What about those that are fighting other illnesses? Do you agree with the CDC statement that all people over 6 months old should be vaccinated?
I'm not familiar with that commercial per se. And that's just because my choices regarding how I entertain myself. Yeah, in the community setting, in the community setting of, say, a skilled nursing facility, you know, the decision to provide a particular vaccine depends on the particular circumstances of an individual. In the setting of a clinic, it depends on the particular circumstances, health history, social history of an individual. I have patients and my own personal belief sometimes gets expressed, sometimes doesn't, but I'll have patients who say, I understand I have these risk factors. I adamantly do not want a vaccine. And I'll say, my job is to nag and to educate, yours is to decide. There are times when people have illnesses that make being vaccinated at a point in time not a safe thing to do depending on the particular vaccine. And there are people who have allergies. You know, a policy should be implemented in a way where the implementers listen and we empathetically respond and we educate, so that if I truly believe that the person I'm speaking to across the room, across the table, at the wedding, you know, whatever, truly should consider, my job is to empathetically educate and try to nudge them to move to a, what I think is a safer position. Part of the reason I say it's my job to educate is because I certainly know that over years, I watch a pendulum swing in regards to what public health policy is and how things are implemented. And I know better than to say, I absolutely know the right answer today. So I focus on what I think is the best information and try to promote what I think are the best decisions.
Thank you.
I just know Mary Jane's on now, so.
Okay.
So just so you're
Thank you.
aware. But, you know, when you have an interest in sitting on a board like this, we certainly appreciate that. But it also says to me that you must have a vision for what you see maybe lacking in our community and where we need to go. Do you have some of those thoughts of what you think that we're not? That
No,
we
no, no,
haven't-
no, no.
Haven't been very good at, and we need to,
Yeah.
direction we need to go.
One of the themes that you hear from me today is that I think that when we implement policy, we need to be able to listen, and we need to be able to have flexibility to understand where there are special circumstances, where there aren't, to look at downsides and say, how do we mitigate downsides? You know, when I look at our community and I see that, you know, a significant number of my long-term care patients, you know, are in skilled nursing facilities because it's the last option available, because we have policies or not policies, we have a lack of resources to allow people to return to their homes safely. And how is it that I can provide information so that people become aware these are issues, or that they're brought to awareness in a different light than maybe they are when all you're getting is published information from the Board of Health or from the CDC? How do I convey what our community experience is and where the strengths and weaknesses of those policies are, and how do we mitigate that or fix that? Yeah, I've lived here for over 30 years, and you know, we at various times have had amazing public health policies. We have people who work with mental health. We have people who work with homelessness. We have private, religious, charitable organizations who do tremendous work. How do we reinforce that and help make this a community where it's easier for them to do their work and be able to reach out, so that we don't have last options where folks who might otherwise be able to be out in a community setting have to live their life in a nursing home.
So is it fair to say what I think I'm hearing? Is it fair to say that if you're looking at policy or you're looking at procedures or whatever, you want to build those from the ground up, from the citizens up, not from
I think it's
not from the government agencies down?
you know, sometimes you need big capacity and big capability, and you need money. Sometimes you need individuals in the community who are motivated and have a vision, right? And if there are questions about how do these policies, these big policies that bring money, bring impetus, bring code type recommendations from the state, you know, who in our community and what are their views, how are they, and how can we legitimize those, or how can we assess those so that we can utilize those people's skills in a way that's unique to our community, right? So that our folks feel like they have a voice and that at the same time, we can feel like we are also honoring the fact that we have lots of resources elsewhere with lots of knowledge that we should be bringing to the table as well. How do we integrate those, the top down and the bottom up?
Thank you.
Can I add, can I, Jump
Mary
on-
Jane is
oh,
on.
oh, sorry, Mary Jane.
Because we're almost out of time.
Mary Jane, would you like to ask the last question? Turn your microphone on, make sure it's unmuted. If you're speaking, we can't hear you yet. I think we have some technical difficulties. Hmm,
Did you want to ask your question, Lindy, or I was going to ask one that I
Go
think
ahead.
Mary Jane has asked?
there you go.
It's fine.
Mary Jane asked a very good question last time, which was, when does a personal health crisis become a public health crisis?
So a personal health crisis becomes a public health crisis if I have a problem, an illness, and I am in a spot where I am not regardful of what needs to be done, and yet if I don't take care of it, I will adversely and seriously impact my neighbors. I guess I think in a non-medical thing, I would think about, do I have a neighbor up the hill burning a slash pile right now? It's a problem for he and his land because it's dry. It's at risk of getting out of control, but it's a community issue because it could seriously impact all of his neighbors and the surrounding community. So how do we convince that individual that while we may be limiting their choices and may make that individual feel as if we are constraining them, how do we convince them that the greater good is to say, let's not burn the slash pile at the end of July and beginning of August?
Thank you for that answer. The 20 minutes is up at this point. Did you have any last questions for us?
I guess my statement is that, after having worked with individuals and with different organizations for years and providing feedback and helping to nudge and do that work, I felt like this was a really positive way to directly involve myself and help my other neighbors, the people that live down the road and up the road from me, the people who I say hi to on the street in a different fashion and yet utilize the skills I have. So I thought this would be a marvelous community building opportunity for me personally.
Well, thank you very much. And thanks for what you do with your facilities.
Thank you.
Thank you, Dr. Randall.
Thank you.
All right. Appreciate it.
Okay, moving on. I don't want to be a tyrant, but we got to move on because like I said, it's a long day. So now we have Patricia Peterson, PJ. Is Patricia Peterson here? She
might
locked,
be in the
did you lock her in the closet back there?
Yeah.
Last week, the board didn't know that the people were all waiting in the back, and so we had a little problem there.
Hey, Kelly.
Yeah, we
muted
can hear you, Mary
still?
Jane. Thank you.
Oh, good. Thank you.
Okay, we're waiting for the next person to come in now. Hello, welcome. You're Patricia Peterson or PJ? You are. Okay, welcome. Thank you for coming.
Yes.
Um, Thank you for the interview. You're interviewing for, sorry,
Healthcare facility.
healthcare facilities or providers. We have your application. I think most of us have read it. Let me start we'll alternate. So Mary Jane, if you would like to ask the first question. I think, Mary Jane, we can't hear you. You got to unmute again. I'm not sure if she's talking to us or to her driver. Well, let's go. Commissioner Weber, would you like to?
Wait.
Oh.
I'm here.
Wait,
Oh,
wait,
good.
wait.
Sorry.
Okay. All right. Go ahead, Mary Jane. Go ahead and ask the first question.
Dr. Peterson, I'm very interested in understanding what you view as the definition of public health and how public health differs from personal health and how that would influence your discussions and decisions as a part of a member of the Board of Health.
Okay, I didn't catch part of that.
Okay, so I'd like to know and understand your definition of public health and how that differs from personal health and how your definition would influence or direct your discussion and decision as a member of the Board of Health.
All right. Okay, so public health to me is people in this room, my next door neighbors, everybody in the community, and raising the level of our overall health. It's just everybody within the community. Now, as a clinician, it would have been my patients, but it also extends to their families because the health of one person affects the rest of the family as well as the community. My personal health, I'm responsible for that. I believe I need to set an example. For example, I never smoked. I had patients who smoked. I accepted that was their level, but it was my mission to raise the level of their health to what I could. And I would always be working to raise awareness, to raise education, to understand where everybody is at their level and meet them at that level and help communicate that information to the public as best I could.
Thank you.
Commissioner Weber?
Good morning.
Good morning, PJ. Good to see you again. As you are aware, the response to the pandemic was a bit controversial in Cowlitz County. What have we learned about the best way to respond to something like the last pandemic?
Oh my gosh. Well, I thought of COVID in a way as like polio was back in the 50s. You know, it was scary, people died. We created vaccines to protect our community, but there were still people who did not understand, didn't believe. You know, COVID was much like that. It was polio all over again for some people. Certainly information and misinformation spreads, you know, like wildfire. And there will always be people who don't understand, don't believe, don't accept, but we do the best we can to take care of those people that are affected, the families that are affected. I happen to have a neighbor who was very anti-vax. I did not know that until the morning the ambulance came to take him to the hospital. And I was attacked because we were vaccinated and they weren't, and we were accused of spreading the COVID. We're still friends.
Thank you.
Dr. Peterson, I wondered, what is one of your top concerns for public health in Cowlitz County?
Well, we have several major problems. We have addictions, we have homelessness or houselessness, depending on how you want to look at it. We have education challenges, now we're coming out of COVID, we have even more education challenges. We have, smoking and alcoholism, which will always be here. The Pathways 2020, which now we're in 2024, it's amazing how quickly 20 years go by. We still have challenges in improving the overall health of our community. And some of the ways we can do that is by affecting our education, our medical care, our access to care, and that sort of thing.
Thank you.
Sorry, I have to repeat a question from before. The CDC is saying that all people over 6 months of age should be vaccinated, all people. Do you agree with that? Or do you think that they should say, consult your doctor?
Well, I'm not a pediatrician, so I really don't know that at the age of 6 months, we should be vaccinating against COVID. I'm not there at this point. There is an age, I'm sure, where it's going to be recommended, but then again, it's always recommendations. There are always going to be people who we shouldn't be vaccinating, but I'm having a hard time going to 6 months of age.
Thank you.
You mentioned some of the issues we face in Cowlitz County. What do you have any, what should be our role in that? Should we be setting policy? Should we be dispersing information? Where do we kind of fit in as a Board of Health? How do we fit in and help curb that?
Well, I think education, sharing legitimate information, some of it is access. It's helping people understand, I think, access to care. I happen to be one of the volunteer physicians at the free medical clinic. And over the last several months, we've been able to have people from our homeless areas, not just Hope Village, but other homeless people being able to access care. I think distributing information is probably the biggest thing that we should be doing as far as public health. We're not going to run out and vaccinate people. We're not going to run out and have clinics ourselves, but we are going to inform the public of what
Turned
is
around.
available and sharing the information that is reasonable to share.
Thank you. Commissioner Martinson.
I had so many questions and I can't really decide which one to ask. Inherent in some of the data that's available out in the internet is tons of data. Some of it is really hard to figure that it's legitimate, but when it comes to the reports from World Health Organization or the CDC, we find that the United States spends more than any other nation in the world on the public health, and yet we're not the topmost of nations with the public health assessment. So what is the disconnect here? What can we do to improve this?
To improve overall public health?
Most of the time when we sit here, people connote progress with funding, money. We solve all problems with the money. So apparently that's not true based on the data that's available. So there must be something else. And we look towards the subject experts to tell us where we're going afield.
Well, you can pump $1 million or $1 billion into the wrong place and not get the results. So we can only take care of the public health of our community, our region, our Cowlitz, our county, whatever it is that we're covering. Figuring out where to spend the money to get the best results. If you're talking about raising the level of public health, if you're raising awareness, I mean, I don't believe in spending money where it's not going to make a difference. Now, I grew up relatively poor. Nowadays, you probably were considered poor, but we didn't feel poor because my parents were frugal and smart and raised 6 kids on a farm and had cows and chickens and all that. But we can educate people and help them become smarter and spend money in smarter ways. I really don't know how to solve the world's problems. I only know how to tackle what's in front of us.
I'm sorry, I didn't catch that last statement.
I don't know how to solve the world's problems or other countries' problems with public health or how to change this whole country, but I only know how to direct what we can do in our community.
Well, that's precisely what's on the table, but the world is made up of a lot of communities, and we apparently are not achieving.
Okay, I'm
the
having
zenith.
trouble, I'm wearing hearing aids and I'm having trouble understanding you. I'm sorry.
Hearing me or
Hearing
understanding?
you. Can you get closer to your mic?
I
It
don't think I
is a
can
little
get
low.
much closer.
That's better. That was better.
Oh, really?
Yeah. it was a
Oh,
little low.
I was saying the communities make up the universe. So whatever we do here should be an indication of whether we can scale it up and be successful. So I'm not asking you to solve the world problem. I'm saying you, as a member of the Board of Health, you will be making suggestions as to how we solve the local problem.
Correct. Correct.
Thank you, Kelly.
Uh-oh, somebody amped the mic. No, of course, it would be helping to figure out how we spend money appropriately in the local community to improve our public health.
Okay, and so the follow-up on that is we've been in business in this county, certainly the health system for quite a while. Our HHS department is at least as old as
You.
well, probably as old as I. And so I'm looking to see what you have concluded from that first day on the job, on the board, this is what I'm going to advocate.
What's on the agenda for the first day of the board? I'm going to look at that and say, how should we address this issue or that issue? Without knowing that agenda, it's kind of hard to answer the question, but it'll be what is the most important thing on that agenda that I can somehow influence.
Okay, thank you.
I have a quick question. This is Mary Jane again. Can you hear me?
Yes.
Go ahead, Mary Jane.
So I guess my question for Dr. Peterson is, and kind of following up with what Arn had to say, is that there's been a health department and public health has been around for a long time, and there have been a number of agencies who are trying to tackle public health issues within the community, and still we have public health problems. And I guess my question is, how do you know, how do we know we've gotten better, gotten worse, or stayed the same? Because there's not been a baseline study. So we are maybe way better than we would have been 20 years ago without the Family Health Center or without the health department or the Board of Health. So I guess my question is, unless we measure, is there a way to decide whether we have made progress in terms of public health, or can we just assume since we still have public health issues that we've not had an impact on public health?
Okay, so a baseline of certain things, you can look at the level of obesity. How much obesity is there? How much smoking is there going? How much drug addiction is going? How much alcoholism? We have some idea of what's going on there. I don't know that I would spend a lot of money doing a survey necessarily to figure out exactly where we are on that, because we know, I think the state may have some statistics that we can use. So getting those statistics from somewhere that might already have a baseline for us would be a place to start. I know those studies have been done in the past. And then taking what we think could be most impactful for the majority of people, or the people who we would like to tackle first, and taking those problems one at a time, ranking them in priority. Where should we spend the money to improve our public's health the most for the amount of money that we have, and just taking them and prioritize that sort of thing.
Thank you for your answer. We're running out of time here. Do you have any questions for us? It's not mandatory, just
Not really.
offer. One more short question.
I just wondered, we always are trying to figure out how to communicate because education was a big piece of what you were saying is important in public health, helping us work through our problems. What do you think would be a good communication tool to communicate with the public, and what venue or whatever? Do you have any ideas? Because we're always trying to determine what is the best way to get the message out.
Well, I heard we had used to have a really good newspaper. It's not as effective these days.
It went away.
There are multiple venues. I don't really know what you can do community-wide. We can have forums, we can work through the newspaper, we can sponsor clinics, we can have open meetings. We can work with other organizations that have access in some ways, whether we're working with the Family Health Center, whether we're working with the hospitals. We can use organizations that already exist to spread information as well. We're not the only game in town. There are other places who already have that access, who already have listeners, and we can work with them instead of creating a whole new venue.
Good idea.
forum.
Thank you.
Yes,
Thank you very much for coming. We appreciate your time.
thank you.
Thank you.
Moving on to the next person, we have Dr. Michael Grubbs for an interview. Oh, you gotta go unlock them. So Dr. Michael Grubbs is coming in. Dr. Grubbs? Hello. Thank you for coming.
Thank you.
The board would like to ask you a few questions, give you an opportunity to ask questions of us as well at the end. Each candidate is going on for about 20 minutes. And we'll start, I guess, alternating with you. Lindy would be the first question.
Hi, Dr. Grubbs. What would be your number one public health concern as far as what we need to tackle in Cowlitz County?
There's probably several opportunities, certainly health choices as far as obesity, smoking, other substance use. I know the commissioners have talked, and the Board of Health have talked a lot about drug abuse, but alcohol
Can you
abuse.
hold the microphone a little
Sure,
closer to you?
I'll scooch in.
You can
Sorry.
move it. You can move it.
Okay. Sorry, not used to talking into a microphone. But I think those are some of the opportunities for the county that we can work on to improve our public health.
Thank you.
First of all, I want to say thank you for your service.
Mhm.
You're a naval officer,
mhm.
medical officer.
Mhm.
Very good. The CDC has a commercial on TV saying that everybody, all people over the age of 6 months should be vaccinated. Do you agree with that?
I would trust the CDC's recommendation that they're data-driven. As far as, are you speaking specifically about COVID vaccination, or are you speaking?
Yes.
Okay, that's what I assumed.
Sorry, I
ask,
should have
but-
clarified.
But yeah, again, the COVID virus has changed over the years of the pandemic, and so has the vaccine, and the vaccine will be updated this fall. And I assume, actually, I know that the vaccine should cover the new variants that are coming out. And I firmly believe the best way to prevent illness is the vaccines.
Even down to 6 months?
Yes. I
Okay.
think the data has shown that this has been safe and effective. I'm not going to say that there's not side effects from a vaccine because any medical treatment has side effects, but I think that the benefits outweigh the risk of the vaccine.
Let me ask you this, the statement was that all people over 6 months, would you, my belief is that it should say consult your doctor. So would you also recommend if somebody's allergic to that, or if they're recovering from an illness?
No, obviously, if they're allergic to it or had a medical contraindication, like say their immune system was such that they shouldn't get the vaccine, then they would want to consult their doctor or their specialist, you know, an allergist or infectious disease specialist. But there are, yes, obviously there's going to be exceptions, but the CDC can't come out with, oh, yes, you should consult your doctor, but the general recommendation is the vaccine is probably the optimal way to prevent illness.
Okay, thank you very much. Mr. Dahl?
In one of your statements, yeah, I've also seen how poverty and lack of consistent medical care affects the health of Cowlitz County residents. What should be our role in addressing, you know, what you're saying here?
It's probably tough on the county level to address that. And at the state level, I know we can lobby that for the state programs that help fund medical care for patients. But as I mentioned in my application, I work at the Cowlitz Free Clinic, and you see many folks whose health insurance is based on their employment status. And if they lose their employment, then they don't have health insurance and they can't take care of their acute or chronic medical problems. And again, the free clinic does great work, but it's not a comprehensive health system by any means. I think advocating for our patients who don't have the income or don't have employment to have some basic health coverage is probably the role of the county, but also supporting those systems that are safety net programs as well, such as the free clinic and the family health center as well.
And what health issues are arising from us not having some of this? What are you seeing?
What I see is untreated diabetes. I see that at the hospital. I see that at the free clinic, untreated hypertension, folks with lack of access to dental care as well, which certainly affects their general well-being and their quote unquote medical health as well. I see a lot of folks with untreated dental issues that affect their quality of life as well.
Thank you.
Mm-hmm.
Commissioner Martinson?
It seems like I have a choice again from a number of questions. I will start with, can you tell me when a personal health crisis becomes a public health crisis?
I can think of some examples. We have seen cases of tuberculosis in the community. And I mean, that's the classic public health crisis, just because it exposes people's families and their people they interact with to a potentially, you know, deadly agent that, you know, we can control with good public health measures. That's, again, one of the classic things. Or if somebody, say, somebody has a infectious or a food exposure and is exposed at a restaurant or something, you know, they may go to their doctor and say, I've had these GI symptoms, but I ate at this place, and maybe the public health department is getting other reports that either a restaurant or other establishment may not be providing, you know, safe food handling practices.
It's interesting to me because I think your two examples are excellent examples, but they're not the ones I typically hear. I hear about obesity, not that it apply to any of us, and I hear about alcoholism and drug abuse. And we call them all a public health crisis. That leads me to ask you, what makes them a public health crisis?
Well, I mean, I think we can say, just take obesity, smoking, and alcohol. All of those have personal health consequences. And if you think about when someone goes and seeks medical care, who's the largest payer for medical care? It's the government, which is the people between, Medicare, Medicaid. Those issues affect your healthcare spending and affect everyone as far as what folks are facing as far as health problems. And if we can make it easy for people to make the right choices as far as food choices, activity choices, make it easy for people to walk or bike or get the activity that they need, make it easy for people to avoid smoking or quit smoking or have, treatment for alcohol or drug addiction that's readily available. Those things, I think, can make a big difference in the public health sphere.
I think, again, that's an excellent answer, but I don't know, historically, like the United States spends the most on public health than any nation in the world, and yet we're not up as number one there. Getting the message out doesn't seem to imply compliance with the message. So you have sent us a few emails.
Mhm.
If you were on the board, what is the number one thing you want to accomplish as a board member? Or I should say, let's make it more of a narrow question.
Mhm.
What is the very first initiative that you have in mind?
I would think it would be working with the county health department and our other, agencies in the community that have a public health influence to, again, use Daniel Kahneman talks about behavioral economics, but making it easy for people to make the right choice, incentivizing people to choose healthy foods, to choose activity, to choose not to smoke.
Okay, I'm looking for someone who's got that solution.
Yeah, it's hard because we have to deal with people, and people, everybody has to make their own choices, and it's very challenging to bring people along.
MJ,
I'm here. Oh.
Mary Jane, go ahead, ask your question.
So Dr. Grubbs, are you familiar with the state foundational funding that's sent to the county every year?
What I've read about, only in the newspaper, as far as what I've read for the public health funding, I'm not familiar with the specifics per se.
So I guess my question is, you probably know just my understanding is that the state sends the county about approximately $1.4 million to help the county health department address public health issues within our community. So you're in charge and you have access to this $1.4 million. What would you do with it?
I would work with our health department leaders and community leaders to find out, where can we make the biggest difference for the health of our community with these dollars. I know they've done community health surveys over the years, and I was actually participated in Project 2020 many years ago, and there are obviously a lot of opportunities in the community, and I think working with our health department leaders to identify the most effective use of those funds and programs that provide good results. I know the Board of Commissioners likes to see the data, and I agree you need to prove your effectiveness, but I know there's folks out there that do have those programs that
So-
can help our. Go ahead, sorry.
So a real quick follow-up. So you have a level of confidence that the staff at the health department kind of have a handle on what the health priorities are within our community?
I think the folks doing the day-to-day work have their finger on the pulse of the health issues in the community. I mean, that's what they've been tasked with, and I think that they're going to be a great source of information to tap. And we, as a board, we shouldn't be handling the minutia. We should let them be out there, and we provide oversight to them, but they are the boots on the ground and know what's going on in the community.
Thank you.
Thank you for that answer. Do you have questions for us? Oh, sorry. Sorry, Commissioner Weber. I'm having trouble counting them all.
I would like to kind of go back to some questions about our response to the pandemic.
Mhm.
You know that it was a bit controversial how it all played out in Cowlitz County. The experts came up with all kinds of recommendations and suggestions for mandates and policies and procedures and lockdowns and shutdowns. But they always said, they gave themselves an out and said, we're still learning. We don't know very much about it. We're gathering the information. The implication is at some point they're going to share with us what they've learned.
Mhm.
What should we do differently next time out?
Well, I think there's, if you read the medical literature and the public health literature, people are getting those lessons learned from COVID. And I think the next pandemic is going to come. I mean, everybody says that, and we know it's going to come. Nobody knows what it's going to be or what it's going to look like, but there will be another one of an outbreak of an infectious disease that we have to deal with. But I think we need to go back, and the public health part needs to look at what we learned, what worked and what didn't, because we know there are things that worked well and there were things that didn't. We also know that it's difficult to shut an open society down completely. It's very difficult, and it was very disruptive, but it was also very scary on the medical side when you're dealing with an overwhelmingly sick population and your resources are overwhelmed and you don't know what the best way to manage this is. It was very challenging to deal with, but I think I'm sure at the CDC level and the public health department levels, they are reviewing what worked and what didn't. I have to trust that we will synthesize and be better prepared the next time. I think from a public health infrastructure standpoint, we will be better prepared for the next pandemic.
Are you aware of much of the new information about the importance of fresh air exchange?
I've heard that, and that was coming out during the pandemic. Building engineering was a big deal as far as air exchanges and things like that. And I know I've heard, the Hall of Justice air handler issues, and I know you all struggle with the budget because those things are big budget items, but those make a difference as far as disease transmission. There's many public health studies of outbreaks of illnesses in buildings related to air handling.
Okay, thank you.
Do you have any question for us?
I don't. I appreciate the opportunity and just wanted to say, I know Dr. Peterson, Dr. Randall, and I listened to Ms. Joyner's interview, and I'm sure Mr. Buckman would be an excellent representative of the citizen of Cowlitz County. I think you have a good slate of candidates, and I think, again, anybody you choose will represent the county well. So,
Thank you very much for your time, Doctor. Okay, we're going to move on to the next Diane Cooper. So, let me- first, I guess. What kind of work? Hello and welcome. You're Diane Cooper?
Yes.
Thank you. Thank you for coming. Thank you for your time and coming to the interview. We're allowing 20 minutes for each candidate. And the board will go around and ask questions. I guess I'm the first question here this time. On your application, you wrote that the Board of Health has been following false science. Can you give me some evidence of that?
I think your Medical Freedom Act speaks to that quite well.
What in that specifically
Well, I get that.
is
you guys-
false? What is false?
Yeah, I get that you guys are mad about COVID, but the standard science-based intervention in an epidemic, part of that is isolation and taking all the precautions that the various health professionals were recommending.
Well, I'll leave it at that one. Commissioner Dahl.
I don't know where to go here because we had a conversation yesterday and I don't know
Right.
if you want me to, want to bring that up or,
Sure.
yeah.
So since I put in my application, just to be open and honest about all of this, I have undertaken several additional obligations that I didn't anticipate. I'm on the Children's Justice and Advocacy Center Board. They recently lost their director and we're in the job search phase. And so I am temporarily stepping in to do a lot of the day-to-day work for that organization. And I had a contract with the EDC to do some grant writing for the Catlin and Maine project. And the second phase will start in September. So between now and 2025, my plate has become fuller than I anticipated when I applied. And so bottom line, I think you all have many very well qualified candidates. And I would prefer that one of them be considered over me. I'm still willing to serve, but
Okay. I didn't mean to put you on the spot. I just don't
no.
want to run you through a process if it's
Yeah.
not something you have interest in.
Just to be clear, because you were applying for two different positions,
Right.
actually. So you wish to withdraw your application?
I'm still willing to serve in either of the positions if no one else is better qualified, but my preference
Okay.
would be that you
Pick-
pick somebody else.
Gotcha.
Okay?
Understood.
Okay.
Thank you.
So with that then, I've kind of been asking what candidates see as the issue in Calais County that we think this Board of Health needs to address.
So I think that there are several pressing public health issues. The big one that I think everybody in town agrees on is the fentanyl crisis. Somehow, I think we need to, as a community, get our arms around that and make that, if not go away, at least get a lot less intrusive. Environmental concerns are always, I think, something that public health needs to keep their eye on. Clean water, clean air, that's important to all of us. And the continuing work with communicable disease prevention and education, I think, is very important. And then nationally, I don't think as much here as nationally, gun violence is a huge issue.
Thank you.
Commissioner Martinson.
Well, in view of the announcement, it's a little bit, anyhow, quite some time ago, Galileo was ended up in the courtroom where the scientist of the day, excuse me, insisted that he was in error. So I think there have often been discussions of what is science and what is evidence-based. And you have alluded to the science. Tell me about your credentials and what makes a scientist and these kinds of things.
So some folks are aware that I was the CEO of Cowlitz Family Health Center for over 30 years. A big part of my job was crunching data and designing programs to improve the health of our patients. We were a partner with the health department all along and took over several of the personal health functions of the public health department when they decided it would be more appropriate to be done elsewhere in the community. A couple examples are STD screening, sexually transmitted disease screening, and the harm reduction program would be two examples of that. So my master's degree is in special education. Any particular discipline that you pursue educationally, I think you have evidence-based practices and programs, and from time to time that new evidence comes forward that would cause those programs to change or to modify. So I don't see science as what was evidence-based in the Middle Ages being evidence-based today. Science, like everything in our lives, changes.
You specifically mentioned the fentanyl crisis. How would you tackle that?
Well, I think one thing is trying to control the influx of the drugs themselves. And I see.
No, if I could get you to focus on something you think we can do.
Right.
You know, all the normal discussions have all taken place. We've discussed this for a long time. So you must have something specific in mind that you think we should be doing on the Board of Health that isn't being done.
So I think from the Board of Health, the focus should be on harm reduction programs and working with other organizations and disciplines to get those who are addicted into treatment and into recovery. And our local health department also does some of the human services programs, which is why I mentioned specifically the harm reduction.
How would you feel about having a?
Oh, okay.
Sorry,
Whoa.
was it my turn?
You skip Dennis and Mary Jane.
Oh,
So wait your turn. Mary Jane, would you like to ask a question?
Yeah, my turn. So, you know, while I'm listening to you, I'm thinking of lots of good questions. But then when you come on, so you were in charge of the Family Health Center for 30 years. And over that time period, what changes did you see as a result of the Family Health Center being a part of the community? Did you see improvements in some health areas of public health, and did you see some things get worse over your tenure as the director for the Family Health Center?
So I definitely saw tobacco use getting better. Teen pregnancy went up and down, and individual health behaviors, this county continues to be in the bottom quartile in the state with a lot of those health measures. But I do think that community efforts, not just by Family Health Center and education and case management and support, has helped that in partnership with our medical community.
So real quick, a follow-up question. Again, are you familiar with the state foundational funding that's sent to the county annually?
The what?
Foundational funding that's sent to Cowlitz County by the state?
I'm not sure I exactly know what that is.
So my understanding is that every year, Washington State sends each jurisdiction funding to be used for the health department and for health department issues, public health issues within their community. And over the course of that last 3 or 4 or 5 years, the bulk of that funding has been returned to the state. So if you're in charge and you receive the $1.4 million, how would you utilize those funds?
Well, first of all, I'd hire an epidemiologist again, rather than share one with Clark County. I know that doesn't cover the whole amount of the money.
Right.
I think that increased public health education is something that would help this community immensely.
And,
Okay,
and to
thank-
follow up with, sorry, can I go one more?
Go ahead.
To follow up, how would you see, how would you envision implementing a public health education program? I mean, flyers or workshops or classes or Facebook or
So
how would you envision that?
Yeah. One of the most successful public health education programs has been in tobacco cessation. It's actually a chapter in a book by one of my favorite authors, Malcolm Gladwell. And it's speaking with folks, developing protocols in primary care practices to continually ask people, are you ready to quit? In essence, bring the problem to the attention of the people that might be suffering from those issues. Individually, doing workshops in the community, doing billboards, doing flyers, doing radio PSAs, and because we're in the age of social media, doing social media, I think, are all things that would have to happen in a campaign like that, as well as including the local medical and other communities to help spread the word.
Thank you.
Thank you. Commissioner Weber.
Good morning, Diane. It's good to see you again. And I do want to acknowledge your role in the harm reduction program that got shifted from the county to the Family Health Center. When that happened, the Board of Commissioners was in the process of developing some protocols and some suggestions on how to reduce the overwhelming abuses that were going on with so many syringes being made available. And you came up with some very creative ideas and really were instrumental in making that a much more responsible harm reduction program. You're very much aware that the pandemic, the COVID pandemic, and its implementation here in Cowlitz County was pretty controversial.
Mhm.
You know, you alluded to the Medical Freedom Act and all that. We heard from the experts, the CDC and all those folks who came up with all kinds of suggestions on how to deal with it. Lockdowns, social isolation, small business closures, but not the big business closures. And, but they always use the phrase, but we're not quite sure. We're learning about the whole thing. So my question is, from what you have learned and studied, what are the changes? What would we do differently if a similar epidemic, pandemic would hit? What have we learned from the past?
Well, I think we have learned that the business closures were not necessarily the most effective thing to do. Particularly as you've alluded to, big businesses stayed open, hospitals and clinics stayed open. But there are things that individuals, businesses, and communities can do to reduce the risk. And I think things like masking, things like hand washing, things like social distancing, things like the most vulnerable, giving them support so that they are not exposed, so they don't have to go out in public. Those things they actually worked. And I think we were fortunate in this county that we were not one of the high prevalence counties. I think if we were a high prevalence county, you know, closing businesses would make more sense. But I think in this county, particularly if the businesses were following some of the really common sense things in terms of sanitation and spreading people apart, we would have, well, we did come through it fine for the most part. I mean, we all know people who died. And maybe we could have done something more.
Thank you.
Hi, Diane.
Hi.
So going to gun violence, did you mention something about gun violence?
I mentioned it as a national issue.
Uh-huh. So do you see gun violence as a mental health issue or a gun issue?
Well, I see it as both, quite honestly. When unstable individuals who have behavioral health barriers have access to automatic weapons, it's a recipe for disaster. I grew up in the Midwest. My whole family hunted. You know, my dad took me out, taught me how to use guns. So I might have a very different perspective of what guns are appropriate for. But anytime you have somebody that can walk into a school and shoot kids, and it just keeps happening over and over and over again, this is a population problem that probably needs to be addressed, not just on individual, get them mental health help, or figure out who might go off and do law enforcement intervention. But I think we have to look at kind of the whole cultural aspect of it. I do think most gun owners are responsible. And this is a minority issue, but it is a population issue.
Thank you.
Not as much in our community, thank goodness.
Do you have any questions for the board?
I don't. I understand you meet once a month.
Sorry?
I understand you meet once a month.
Correct.
And you're staffed by health department staff, and the health officers usually present. And you discuss a wide variety of public health related issues and make recommendations. And I think I have this right, that the non-elected individuals on the board make recommendations, but the county commissioners are the ones that actually ultimately make policy.
That's correct.
Okay.
Well, thank you very much for your time and for coming.
Thank you.
Thank you. Okay,
Thank you so much, you guys.
thank you very much. So we're doing pretty well on schedule. Jennifer Leach would be our next candidate. Yeah, Jennifer Leach is for the other community stakeholders.
Oh, great. There she is.
Hello, you're Jennifer?
Yes, I am.
Thank you. Thank you for coming.
You're welcome.
We're going to ask you a few questions. Allow all the candidates 20 minutes. And so we've been alternating. And I believe the first question comes from Commissioner Dahl.
It does? Okay.
Yeah, I went last.
How are you?
I'm
Good-
fine. How
good
are
to- I
you?
know, long time no see. huh?
Long time no see, yeah.
You know,
Notice I'm wearing purple, for
Yeah.
those University of Washington folks.
How do you get away with that?
Just a quick
Well,
question.
This is my
I'm gonna
favorite
rat you
blouse.
out to Gary, you know
Yeah,
that, right?
yeah. We don't have a dress code in the office.
Commissioner Morrison?
How many people have we talked to this morning? 3?
4.
4. So I'm 1, 2, 3, 4. So you're the one. Or we skipped Lindy.
No, we skipped before. So I asked the first question last time.
Okay. I'm trying to help you, Rick.
I know, and I'm not always a multiple question answer. I kind of listen and just glean stuff, but you know, what I have been asking people is what do you see as the issue that we should be tackling as Board of Health, and how should we do it? Are we missing something, or are we a little bit off track somewhere? Are we not looking at something we should?
Wow, that's a tough question.
Yeah.
Because the Board of Health, you have quite a few areas that you focus on. And of course, from my perspective, and it's probably where my area of interest is that it's really around substance use disorder for families and of course youth. So, but I think but there's so much out there that the role of public health. And I think to answer that question, I think it's important to, what does the data say? What does Calhoun County's data say around social determinants of health? Or, or what is, because we have a lot of risk factors, unfortunately, in Calhoun County, but we also have some really positive protective factors. So, I think as you probably looked at my application, is that I've been involved in the community with various advisory boards, Health and Human Services Advisory Board, Substance Abuse Advisory Board, et cetera, et cetera. But I think what's most important is with the opportunities for funding is having a full-time epidemiologist that can look at the data and then help guide the decision-making of the Board of Health. And I think that's critical.
Thank you.
And I could go on and on and on and on, okay?
I'd like to ask 2 questions sort of on, and they're associated. The first one, and you are probably one of the more experienced people that could answer that, which is you can tell people until they're blue in the face that smoking is not good for you, but yet they go out and start the habit of vaping. There's even all kinds of stuff. What is it that we miss? Because we talk about PSAs and there isn't information out there that people don't know. They simply ignore it because it can't happen here, it can't happen to me. How would you deal with that?
Tough question is, if you use vaping as an example, is it really goes back to a couple things is in the, first of all, that education piece. Again, you can educate until you're blue in the face. But I think the other piece is that, are there some environmental strategies? Do you raise the price of tobacco? That's, that type of thing. But it's, it has to be, on a holistic standpoint that what we call the continuum of care is you start with prevention. And I think often, and of course, I'll be candid, I'm biased, is prevention is pretty important, but it's hard to measure. And so we start with prevention and education and then if that's not
If I
working.
could focus you in,
Okay.
instead of generalities, we have to deal with specific programs that we have to do.
Mhm.
Are there some that you would say, we are not doing this, but we should be doing this?
What I would say is if you're going to do programs, it needs to be based on data. What does our data say for Calaveras County? And then also look at what are considered best practices. So
Can you give me something more specific than that? Because everybody will say the same thing, but we've been suffering the problem for decades.
depends on what the problem is. So if you're using vaping as an example,
Okay.
is I just looked at the Healthy Youth Survey last night, Healthy Youth Survey for 6th, 10th, and 12th graders. And so the questions are asked, do you vape? And what's interesting is that most 6th graders most of them are gonna say no. So when you look at the 12th graders, most of them are saying, I would say 80% of them don't vape. So then you have to target on the ones that are vaping. So then it goes back to education, goes back to what are the community laws and norms? What are the parents doing? So it's very difficult to hone in on specific programs unless you see what programs work.
Okay, I got to look at the time. I'm taking much too much time, so let me pass it over. I could talk to you for a long time likewise.
Yeah. Okay.
Yeah.
Thank you.
Thank you. Mary Jane, you have a question?
I do. Jennifer, can you talk to me about the difference between what your definition of public health is and how that differs from personal health?
Was that Mary Jane? And what the
Yes,
question was, what's the difference between public health and personal health?
Correct.
Right. Define public health for me and how that differs from public health or personal health.
Well, to me, there's some similarities is we need to focus on our own personal health and then because that has an impact on the overall public health, but it's also public health also looks at what strategies and policies are in place to address public health issues. So I think they're both, personal health is part of it. Public health is that bigger picture.
Can you give me a couple of examples?
Wow. Well, actually for personal health, it is, what is from a nutritional standpoint, are you eating healthy? Are you exercising? What's your level of, hopefully you're not abusing drugs. Those are that personal health piece. And then the public health piece would be, what is the overall strategies to help folks that are struggling from a health disparity standpoint?
Thank
So
you.
Again, go ahead, Mary Jane.
Thank you.
No, I was just going to say, thank you.
Commissioner Weber.
So good to see you again, Jennifer. And I want to thank you for your many years of service on the Longview School Board. Not just because you were my boss for 35 years, but
it's
but
been
because of
re-
the contribution
yeah,
that you've
thank
made.
you.
You kept him around 35 years. We only kept him 12 here.
No, I won't make the comment. So you're very much aware that in Cowlitz County, our response to the pandemic was pretty controversial. We heard a lot of statements from well-educated leaders that said we need to do this and that, and shut businesses down, keep big businesses open, closures, mandates, a whole host of things. And they always gave themselves an out by saying, but we don't know very much about this disease. The implication was, we're going to be finding out how better to respond. Based on what you've been observing in the last several years, what are some of the big learnings? In other words, what would we do differently based on the data, based on the information that has come down to us? Because we can't do it again the same way.
Right. I think that's, again, boy, you guys are asking tough questions. So, I'll be candid, it all took us by surprise, wow, a pandemic, are we prepared for this? Is the health department prepared for this? Is that we just have to, we had to focus on the science, and we had to figure this out, is that and I'm probably biased for a couple reasons. One, I grew up in a health community and a doctor's family. But with my degree in animal science is that, viruses they're pretty often, they like to look for opportunities. And I think one of the things and we really talk about this in the program I oversee, is biosecurity. So some of the things that went into place were because of the unknown, is how do we just protect ourselves? And of course, the unknown is the effectiveness of the vaccine. So we had to make the best decisions at the time to deal with what we need to do. So if we have to do it again, is one, I think be prepared for how do we address pandemics, and how do we prepare for that. So, and I think the positive that came out of it is we're all more familiar with Zoom, and we can deliver programs, in a different way, but it's just really trying to prepare for a pandemic.
Have you, are you aware of the research about the importance of air exchange in public buildings?
Yes. And I think yes, I am.
Thank you.
Hello.
Hi.
So I was reading through your information, and it sounds like you've been very involved in the Substance Abuse Coalition in
Mhm.
Cowlitz County. I appreciate that. I'm very concerned about youth and their drug use. Do you have anything that you see we are not doing that would be more useful in the schools or in the community? We just need some help. And I know that the schools are doing things, and there are laws that say they have to do certain things. Do you have any other ideas about what could be a strengthening agent to these programs that are harder hitting or more effective, or just anything?
So basically around substance use disorder, or just kind of how do we have an impact? Is
With
that
the
your-
youth, especially.
With youth, okay.
The teens.
So with youth, boy, so a couple things that really could be, I mean, if money was no object, okay, money's no object, is one of the things that, how do we provide more pro-social activities for youth, especially in the non-school hours? Because when youth bond with a positive adult role model and learn life skills and mastery and an opportunity for truly for belonging and bonding, that's where you're going to see reduced substance use. And if money was no object, how do you provide more after-school programs that are of quality? Okay. And how do you provide more, again, money's no object is, again, I'm biased, is, program like Strengthening Families for 10 to 14-year-olds is proven to be effective. Can I tell you 10 years from now that those kids, those youth aren't using substances? Probably not, because we don't have a robust research opportunity. But it's those programs that we know that youth can bond with a positive adult role model. And it doesn't always need to be sports. It needs to be, there's youth that they want to do other things. So how do they have that opportunity for pro-social involvement?
Well, and I just want to say that I know there are funds that the board, possibly the Board of Health has sent back to the Health Department unused, and it was hundreds of thousands of dollars. Am I correct? That was in the Daily News. I don't know how we've missed that as being a point of possible funding for some of what you're talking about. And I hope that maybe we can move forward with that next time when it comes around or whatever.
And I'm, in reading the information is I'm assuming that the money that you receive, I mean, some monies you get from state and federal governments they're very prescriptive, have to be evidence-based. That's one of the things that the three coalitions have to deal with, is they have to be evidence-based. You don't have any freedom to do something that really makes sense for your community, and that sometimes can be a barrier and a restriction. It's the right thought, but it's nice to be able to just make sure you're doing, number one, quality programs, and then not have to be some of those restrictions of is it evidence-based? Because I'm involved in a program as a 4-H faculty. We're not listed as evidence-based because we didn't, amazingly, with a research institution, we haven't gone through rigorous evaluation. But if we follow the principles of positive youth development, yes, we're making a difference in so I could go on and on and on, so.
If you, well, let me say this, this board is working on a list of priorities, because you're right, there's a million different things that we can focus on. So if you were appointed to the board, what would your number one priority, not saying the others are not important, but what would be the first one that you would like to tackle?
Well, I go back to my familiarity with the Healthy Youth Survey, and I go back to substance use disorder. You're probably familiar with the county strategic plan from many years ago that Commissioner Weber took the lead on. Amazingly, is that with that strategic plan, substance use disorder was identified as a top priority. So that's what I would look at.
Thank you. Do you have any questions for the board?
Wow.
It's not mandatory.
Yeah. So I think, I feel like I'm being interviewed for a job. Okay, so, yeah. So I think just a comment is, the role that the reason I applied for this is because I work for WSU Extension here locally, and we're part of the university system, and we're blessed with the support of the 3 county commissioners to provide office space and some funding. Is that a new initiative in Extension is looking at what we're calling health extension. And I have a colleague that's really focused on that. And of course, the university isn't changing my assignment, okay, or I guess they could. But I think that the model of health extension really fits with, helping communities identify health disparities. And I think extension, we can be at the table to help a county do that. Because I think what's important is that, yes, we can take research-based information from the university but we have to look at community needs. And then we have to make sure, is it going to fit Cowlitz County? What may fit Whitman County or King County may not work for Cowlitz County. So you can have good ideas for implementation, but is there a readiness? So I think that's the passion of why I want to be a part of this group, is to look at the whole picture, but I know my role is to just look at the whole picture and be neutral and look at data.
Thank you for that answer.
Okay.
And your comment. I think we got everybody answered, and our time is about up. So thank you very much for coming.
Okay, thank you.
Thank
You
you.
guys have difficult position and I appreciate the opportunity.
And
Thank you.
still half the day to go.
Okay, okay.
So the next one, Bill Youngren. Okay, no problem. We're doing well for time wise. Thank you for coming.
Hello, ladies and gentlemen.
Thank you for your
So I want
time.
to start out quickly by saying that I'm withdrawing my application in favor of Mr. Lane, who has shepherded this committee very, very well for the last time period, and I want to just make a few comments and then retreat. And I want to like explain myself and add some clarity what has been said prior. There has been an extraordinary amount of data that has come out about the lockdowns and the vaccine that has been ignored by the people that were prior speaking. And I'm the kind of person who's an autodidact. I'm a fanatic for finding information. I belong to numerous listservs of medical journals, aggregators, and I have stuff coming in all the time. And I review it based on not the science, but the science of what was the methodology, what was the supposition, cui bono, who benefited from the study, and was it authentic and sincere? And there's a lot of bad information out there that is propagated by pharmaceutical companies, by special interests, and you have to look at each study and determine, is it legitimate? Is the methodology good? Is it golden as far as having double blind or having really solid anecdotal evidence that can be aggregated really intelligently, or is it nonsense? And I'm very good at that because I have a very keen mind and I'm far more educated than I want to go into right now. But the one thing I do want to say is when you blindly accept what bureaucracies say without any question, because they're the experts, you're living in a delusion as far as I'm concerned. Skepticism as a citizen is your obligation to look at things, to look at data, and to make decisions based on your conscience and the best information you have. And there was a lot of suppressed information. They deliberately suppressed information. What was mentioned earlier was the Great Barrington Declaration. We're talking about 16,000 experts who were triple PhDs in their field were ignored in favor of a small group of bureaucrats who went around the country determining that we're going to shut down, we're going to do this, we're going to do that. And the mandate of the vaccine was a human rights catastrophe. And after that, I want to go, I'm sorry, my voice is hoarse. I want to talk about what we can do in this community. We have had 50 years of health bureaucracy nationally and locally, and our health outcomes have gotten worse and worse. Every marker is worse. We have to find creative ways of dealing with that because you have the individual will of people who ignore good advice. We've known smoking is bad for decades. We know drug abuse is bad for decades. People still do it. There's got to be ways to reach people early enough and intelligent enough without being draconian and without self-sabotaging that we do it. But so far, that hasn't been the case. I recommend finding creative solutions and being individualistic and looking at the best way to do it versus taking advice from failed experts. Thank you.
Thank you very much.
Oh, don't go away.
Yeah, no,
If we have the time, would you mind if I took advantage of your background?
Sure,
Sure you would mind, or sure?
do not mind.
Okay.
Sure, go ahead.
So a thing that has, we have CRISPR technology, we have now the technology to target drug design. There's a lot of computational power, a lot of recognition of this is the spot where we want to tackle the molecule, or in CRISPR, this is where we want to change the DNA. And it's in your opinion, are we close enough that we should be able to find more cures than we have, or are we stifled by bureaucracy?
We're stifled by bureaucracy. We're stifled by profit motive and by insincere efforts. What I think has happened in healthcare is the emphasis has been on pharmaceutical solutions over holistic solutions. And I think that's been a failure. And yet there's a lot of technology out there, but and a lot of ways to do cancer that people don't even know about because they refuse to allow the information to be disseminated because our media is controlled by the pharmaceutical companies and other agents, other profiteers who basically pay for the advertising, that pays for the programming, and they're never challenged. And we have that issue.
So you think we could actually solve many personal health problems if we just, that we have the technology to do it?
If we followed science and not the science,
Yeah.
if
Okay.
you know what I mean. True methodology, true actual exploration, and true inquiry. And that's why I like Elon Musk so much, because he really is about inquiry and exploration and not about agendas.
Well, I thank you for your presentation, and I have a lot of trouble with people alluding to science because I don't think they understand science, and they also focus on the experts, and we know that there are always axes to grind. I spent time in academia, and it's not any cleaner than any place else.
As did I. I spent many years in academia and I fled because Maoism started being taken over and I wanted to get out of the situation because inquiry became like shamed. And it's an ongoing problem in our society, and the censorship and shaming is really, really destructive. And I want to give 3 examples of where the science was set and it changed. Statins. We now know that statins were a disaster, that the average length of life extended by taking statins is 4 days. And that's now just come out. The Mediterranean diet, turns out that was a fraudulent study. Another one is gender affirming care for kids. Europe has stopped doing it because all the longitudinal data came back showing that they were 12 times more likely to commit suicide going through the programming than actually being left alone to figure it out themselves and being given emotional and psychological support. So Belgium, UK, all of them don't do it. But here in America, you're shamed as being some kind of bigot if you question that science. And there's other, it just continues. And the vaccine was a complete disaster to the point where the architect of the mandate has said he made a mistake. He just discredited medicine for decades. He actually said that. So there we go. You can't just follow the science. You have to follow the real data.
I did miss the first part on the statins. What's the scoop there?
Statins have turned out to be a disaster. The new research is showing that all the longitudinal studies that have been done, the average life, longitudinal studies, length of time studies, have been done that show a 4-day increase in life and no quality of life increase. But we staked all this on them, all this on a cholesterol test. Turns out cholesterol is okay for you in the right measure. It's not the disaster they said it was. Go ahead and eat eggs and cheese. It's okay. I've always known that. I've always ignored it.
Thank you.
Thank you very much.
You will be around, since you're not going to be on the board, you will be helping us?
I will be raising my voice when necessary. And I also forgot to mention something. I really advocate for mental health crisis inpatient facilities and drug inpatient facilities for people that are a longer length of stay than 30 days, like 120 days minimum, so people can be stabilized. It's one of our great crises in this country that we opened up our asylums and get these people in a place to go and never the funding to fix it. Thank you.
Thank you.
Bill, I would just want to say thank you also. You've contributed lots of information to this board over the last 2 years that I've been here. And despite you withdrawing it, I do hope to see you with more information because you are opening people's eyes to seeing other science.
Thank you. I have hard drives full of data that I share as willingly as people will listen, because you have to follow what's happening. You cannot just stick to an idea and go, I'm virtuous, I did this, and now I'm okay. The life marches on. You have to look at the data. And I will always be around in the community to help where I can and to do what I can to make things better. We have to look at ways to make public health.
Thank you very much.
Thank you.
Thanks, Bill.
Thank you. Okay, well, thank you for that one. That's going to put us at a little 10 minutes early for lunch. Does the board have any comments or anything, or do we want to break for lunch?
Just a reminder, 1 o'clock, I have canvassing board, so you won't see me in this seat. Okay.
So, okay, with that, we will adjourn until 1 o'clock. Thank you very much. Oh, sorry.
Does that mean as the vice chair, I can ask questions for the chair?
I'll turn over my question to you. You know, the first 2 interviews are Mary Jane and Kelly. People.
Okay, we're back from a recess. We're going to continue with the interviews. And Mary Jane, can you hear us?
I can hear you. Thank you.
Okay, Mary Jane, we've got you as the next candidate. And I think we'll just start back over on the right side again for questions.
Who are we interviewing next? Oh, I'm the candidate. Oh, yes, I'm ready.
You're
Are
in.
you ready? Yeah.
I am ready.
Mary Jane, you've asked a rather good question, and I'm going to ask it back to you. When does personal health problem become a public health problem?
You know, I think that some of the applicants that we've listened to have given great examples. If I have COVID and I go to a movie theater and I'm coughing on the people in front of me, I think that's a public health issue. If I choose to not get a vaccine and I stay isolated or keep my distance from other people, that's a personal health issue and a personal health discussion. But I also think that we sometimes lose sight of the broader picture of what public health has to do with. And again, one of our applicants that we interviewed at the last meeting talked about, clean water, septic systems that aren't infiltrating clean water systems, foodborne diseases. Those kinds of things are also important public health issues. So I think that public health is concerned with protecting the health of the entire population, big or small, healthy lifestyles, disease and injury prevention. I believe those are public health issues.
So let me follow up on that. I have a little, yes, I agree with certainly the environmental issues. That's clear to me. What isn't clear is the COVID situation is in fact pretty hard to handle because many of us have, say, flu and we don't know it until it's too late and we've contaminated. And that's why we have got this R factor that's spreads rather quickly. But ignoring that one for the moment, how is my predilection for narcotics a global problem? Or another way of asking that is, I think we've got maybe 2 to 3% of the population that has the problem of alcoholism, drug abuse, and all that, and we are actually encumbering 97% of the public to deal with that 3%. So I'd like your comment on that.
So I think it's a private health issue if you stay home. It's a public health issue if you're roaring drunk, you get on your car and you drive down the freeway the wrong direction. That it becomes a public health issue because you're a public health hazard at that point. if you are a raging alcoholic and you beat your kids go to school and are aggressive to other children because of that, or your kids wind up in the hospital, or your kids wind up in the system, that becomes more of a public health issue. And again,
Except if I might interrupt you,
Sure.
I enjoy discussing with you, and I'm going to chew up a little more time than I should, but
Sure.
we must stay away from the derivative issues in the sense of because there's an alcoholic in the family, someone misbehaves, we start making a lot of assumptions. So I think that's a path that I would tend not to follow. I would tend to follow much more intensely. And I think if we follow that, we would we would tackle the infectious diseases, and we would aptly name epidemics when they're really epidemics.
So I'm not sure that abusing alcohol is an epidemic. I don't know if that's the case. I believe that most people are responsible drinkers. I do believe that you get into a public health issue if, again, you have somebody that's got a number of DUIs and they continue to get behind the wheel after they have had too much alcohol, too much to drink, or they've used too many drugs. But they're going out and they're endangering the public. So that becomes a
Understood.
public health issue.
Well, I've got bad news for you. You're next on the list for asking questions.
I think
Well-
I'll take a pass on this one.
Skip over to Commissioner Weber.
All right. So Mary Jane, you've been part of the discussions, the controversial discussions about the way officials have reacted during the pandemic here in Cowlitz County, all very controversial. And we noticed, and I noticed that when all of the proclamations about shutdowns and mandates and all the rules and restrictions were made, they all said, but we're not quite sure. We're still learning about this disease. So it gets me to the question today, what have we learned that we can apply to Cowlitz County about what to avoid in terms of the next pandemic?
Apparently, there is a rush to make a decision because people are sick. People are getting sick. I believe that the general consensus is, and I've heard it from several other candidates, I have a little bit of it as an advantage because I've heard all the other applicants speak. Isolating people is not necessarily the right thing to do. Closing schools is not necessarily the right thing to do. Paying more attention to children during this time when it's a scary time for them appears to be the correct thing to do. As far as I know, when you get first exposed to a new pandemic, of course you don't know everything. And I think that the reaction was to err on the side of safety. And I believe that the learning and the education process has evolved over time as, you know, I feel like saying the word scientist is a bad word here, but as the public and as the researchers have learned more and more about the COVID in particular, they have adjusted their recommendations and they've circled back around and says, you know, we did err on the side of being overly cautious perhaps, and we should have spent more energy on this and less energy on some of the other things. So I guess, you know, would have been nice to have a crystal ball when COVID first started, but that wasn't an option. So I think that the public officials did as best as they could, and they corrected and took a step backward when they had the opportunity to, and when they had the data to support it.
Thank you, Mary Jane. And I also wanted to say thank you for the work that you do with the Healthcare Foundation. I know that you have been able to help address an awful lot of health situations throughout Cowlitz County in your position on the Healthcare Foundation.
You're welcome.
Hi, Mary Jane. This is Lindy Campbell.
Hey, Lindy.
So hi, I have a question for you. And I'm just going to read a statement that you had included in your bio. It says, I can help improve the health of our community by working collaboratively with the health department staff, the public health officer, and the community. And this was related to probably what you can do in our organization on BOH. But you know, there has been 2 years when you probably could have done all those things. I'm just not sure. I know as a Board of Health member, I actually reached out to the health department and went and spoke with the director and assistant director about ideas for promoting health in the community as well as the health officer. I also worked with the school care coalitions to reach out about prevention programs. And I do feel like that was very useful. And I just wondered what some of your thoughts are about that. Specific kinds of things further you can do.
I appreciate all the efforts that you put in, Lindy. But I will say that from the very beginning, when we first started meeting, I was pushing to have the health department come to us and put together their list of priorities, and also to have the Board of Health identify their priorities. And 2 years ago, start whittling those down and brainstorming and trying to understand what we can do within those priorities to affect the health of the community. So I don't want to sound like a broken record, but I would bet over 3/4 of the meetings, I would say, what does the health department staff think? Because they're the people who are on the firing line. They're the guys who get the phone calls when with the foodborne illnesses. Those are the guys that get the reactions to the, excuse me, to fentanyl. They're the guys who are on the front lines for almost every health issue that comes before the community. And unfortunately, we didn't move that way. And I heard that you mentioned earlier that $1.4 million kind of slipped by the wayside. Well, we actually have been discussing that for a number of months. And so I pushed hard to have the staff finally come to the Board of Health with their priorities identified. And I asked them to put together a budget of what it would look like if they were to have access to those funds. So I would argue that that's what I've done.
Okay, thank you.
You bet.
I just have a simple question. One of the candidates today said that gun violence is a health issue. Do you think that the Board of Health should take that up as a agenda topic?
You know, I think she also said that it's not particularly an issue in Cowlitz County. So I do believe that guns are dangerous and guns kill lots of people. Fortunately, at this minute in time, Cowlitz County has been fortunate in not having to experience that firsthand. I certainly think that there are some safety issues that local jurisdictions can look at, as well as supporting and reaching out to their state legislators and seeing if there are some common sense safety issues that we could have at least a conversation with.
What kind of common sense safety issue would the Board of Health deal with for guns?
Well, I think it'd be nice if we had a voice in saying if a person is struggling with mental health issues, suicide ideation, domestic violence, are those the folks that we want to give access to weapons to? If they've got a restraining order against them and they've already had a interface with law enforcement about domestic violence, are those the folks we want to give guns to? I don't know. I don't think so.
Okay, thank you. Let's go. I don't know if Rick, I don't think he's on. He's in a meeting.
Okay. Is that it?
That's it.
Well, we can go.
We have a little bit more time.
Sure, we can start going around again.
Yeah, there is something that I find curious, and I find that it applies in many, many areas. Like health seems to me to be something that should not be cognizant of jurisdictional boundaries. And when I think about some of the answers I heard today, they're saying, well, in Cowlitz County, and I'm thinking, you mean if I go to Yakima, I'll be more or less healthy? And that is a puzzling thing. Do you have a comment on that?
So I was actually reading an article this morning that talked about the availability and the access for people in rural communities to healthcare, to doctors. Of course, like I think it was 46,000 graduates, or 4,600 folks graduated from medical school this year, but there were only 4,120 residency spots for them. So a shortage of doctors is clearly a problem, and the shortage of doctors in rural areas is clearly a problem. Longview, Cowles County has the luxury of being fairly close to Portland and Vancouver, but you go to more rural counties and they have even less access than Cowles County does. And in fact, if you're in Cowles County and you don't have access to transportation and you call for an appointment and they say, sure, we can get you in January.
But
I think that reflects on your public health.
Aren't
Go
you
ahead.
conflating personal health with public health then? So for example, if arsenic in the water supply is the problem, arsenic in the water supply in Yakima would also be a problem. And
Well, I don't think so, because we have different water sources.
yeah, my point isn't that to say that there's arsenic in both supplies. My point is that we are concerned about clean water, and we might have specific different problems, but health seems to me to be a little more universal than the territorial jurisdictional kinds of things we have. And when we're talking about public health, the answers you gave are, and I think, more for the private health. But it's again, I'm very careful about the domino effect, because in fact, I look at the world as holistic, and I think we do a better job if we looked at the world holistically and realized what we do here has bearing all over the place.
Well, I would go back to my point that I made, is that if you're without transportation and you don't have health insurance, and Longview and Cowles County has fewer doctors per 1,000 people than a metropolitan area, and limited public transportation, then that does become a public health issue, because a percentage of your population does not have access to healthcare at all.
Is there a threshold number there? Like if it's 1% of the population, is that now a public health problem that fits the category you just described?
I don't know. It'd be nice to have the data to support that. But I will say that 11 doctors per 1,000 versus 20 doctors per 1,000 makes a difference on who gets access to healthcare.
So Mary Jane, this is Dennis. Let me
Yep.
ask you, and that kind of relates back both with your community service and things that you mentioned in terms of the funding of foundational health. And that
sure.
is, what would you identify as your top 3 priorities for the board to be working on? What are
Wow.
we missing right now that we're not already doing?
Gosh, I think that there are enough situations where the foundational funding would be greatly appreciated. I believe it was Jennifer Leach talked about one of the best predictors of how well kids turn out, whether they're using drugs or not, is their one-on-one positive relationship with a good role model. I go back to the community school gardens, where those folks the children who are involved are not necessarily strong academic students, or not necessarily good athletes, but they go to this after school and they're involved with the school gardens, and they get one-on-one positive relationship building with the volunteers who were there, the directors who were there, the adults who were there. They learn. And so, boy, I think that using Jennifer Leach's example, and she's worked in the field, maybe that's an opportunity for our community to improve the children's lives in our community, solidify their mental health, give them more opportunities. Does that answer your question?
Sure.
Oh, you wanted 3. Okay. Yeah. I also believe that, everybody says fentanyl is not really an issue until one of your friends loses their life with fentanyl. I think that fentanyl is a problem in our community, and as well as all drugs. Even providing Narcan for our public safety officers without those jurisdictions having to purchase their own, that's huge, because it saves lives every week in our community. It saves lives all across the country. And my third one, I guess, maybe access to medical care, access to vaccinations, access to see a doctor to take care of diabetes or obesity or smoking cessation. Any of those things I think are important. All of those things are important.
Thank you.
Thank you very much, Mary Jane. Okay, we're going to move on to the next candidate. And at this point, the candidate is myself. So at this point, I'm going to hand over the chairmanship, take my hat off, and to the vice chair, Commissioner
right.
Weber, to do the dirty work.
Okay, so Arn, let's just go ahead and let you start again.
But I would be inclined to complain about his misuse of the reflexive. So let me ask you the same question, that is, when does personal health problem become a public health problem?
I think in very rare circumstances, the one that I heard was tuberculosis. And there's, I believe, what I understood from the doctor was that there was one case, only one case in Washington so far, where they actually jailed a lady because she would not take her tuberculosis medicine, and she was going around coughing on people. At that point, they warned her many times and said, you have to stop this or we're going to get a judge involved. And at that point, she continued on, and they did put her in jail for a short time. And so at that point, she was causing a public health concern.
So distill that to a bigger picture. So it's contagion is a problem?
Yes, if there's an outbreak of something very contagious to a small one person, for example, if that person doesn't seek treatment and is continuing to spread it, that would be a public health problem, crisis. Did I answer?
Okay.
Right. That would turn from a personal health problem because they have tuberculosis into now it's a public health problem.
There is a question implicit. I think we have time, so I'll ask it. Do you put them in jail or do you force them to take the medication? Now, I look at jail here not as punishment, but as protecting the public.
That's what it was. It wasn't, she was isolated into it. It was jail, but it was an isolated medical part of the jail.
So would you force feed her the medication?
No, my personal belief, I would not force her to take the medication. I think I would leave her there until she is cured or something. I don't believe that anybody should force anything into your body or onto us. My body, my choice. That's my answer.
Mr.
Dennis,
Chair?
you run.
Go ahead, Lindy.
Okay, so what is your number one health concern in Cowlitz County?
I think
Sorry. What is your number one health concern in Cowlitz County, Kelly?
I think there's a ton of concerns, but I think if I had to pick the top one, I think the best bang for the buck would be to work on prevention for the youth in the drugs, helping the youth not get onto the drugs in the first place, I think is much better than the money spent on harm reduction after they're already hooked.
And how would you do that?
Oh. I've been trying to bring to the table a plan, and I guess I'll say it, a plan that I've been calling the Don't Get Dead Project. And this is for children and their parents. It will be a two-prong attack, helping address the kids in school with some information and assemblies, something that would piggyback onto what ESD 112 is doing. And the second part would be educating the parents into with what's going on in these parties that are going on with the youth. There's already an organization that deals with this. And they do these reality parties for the adults to come and see what the kids are actually doing. And it actually involves the kids becoming anti-drug advocates, and it informs the parents. The police are involved, the coroner is involved, and so that's what I would like to try looking into anyways.
What does the data say about that?
That, well, an ounce of prevention is more than a pound of cure.
That sounds very official.
I think most doctors agree with that.
Okay.
Hey,
Thank
Dennis,
you.
you skipped me. Can I?
No,
can I ask
actually,
a-
I was saving the best to last.
Oh, aren't you nice? Thank you. So I'm going to piggyback on, I think it was Lindy's question. You talked about one priority, but what are your top 3 priorities? That's the first part of the question. And would you in fact utilize the foundational funds? And if so, what program would, I guess this 3-point question, you might take notes. How would you utilize those funds? And it feels like I've heard, and it'd be interesting to have somebody in the room who knows more than I do about the programs that were the DARE program and your brain on, this is your brain on drugs. And I believe that the data shows that those programs weren't necessarily effective. So I'd like your thoughts on those 3 points. Thank you.
I've heard from police myself that the programs were effective, and the DARE program just kind of aged, is what I was told. As far as my top 3 priorities, I gave you the 1 priority, and that's where I think we could spend some money. The second 2 priorities, I don't know what they would be. In fact, I would like to wait until we have the further discussion with the HHS department, who's preparing a list of priorities. And then at that point, the board as a group should try and pick the top 3. That would be my answer.
So I think
Thank you.
I think I know the answer, Kelly, but what I've asked others to say is to talk about what learnings do we have from our experience dealing with COVID that we can avoid going through the bad side of the COVID response.
So the question is, what did we learn?
Yeah.
Oh, I think we learned that locking the schools down was a bad idea. I think locking the businesses down was a bad idea. I don't think that letting Walmart be open and local restaurants and hairdressers who need more money than Walmart, I would like to add, that it was fair that they were open and the others were closed. And I don't think the fact that they did close those stopped 1 case of COVID at all, because they're all going to Walmart still. So those are some of the things. I also think that freedom should be always should be pursued and protected, and that the government and the experts, so-called experts, did make some mistakes. They covered up things. They lied to us. They lied to us several times. My example, first easiest example is, if you get vaccinated, you won't spread it and you won't catch COVID. I think everybody understands that that's not true today, but that's what they told us. So that would be my answer. We learned several things of what not to do. I think I would also add what we did learn that maybe was right was Sweden. Sweden did not lock down, and Sweden had the lower cases of deaths, and their economy did not get hurt. So I think we should have followed Sweden's idea.
Arn?
If a thing that bothers me with a lot of conversations is they don't look at both sides of the coin. They're not holistic. For every action, there's a consequence and unintended consequences. Now, in this case, I've heard discussions where people are talking about the money. And yet I've let people know, I looked up the numbers, that we spend more on public health than any other nation in the world. So it's not like if there's another $1 million, how are you going to spend it usefully? It's more like figure out what it is you're doing now that is not effective and don't spend the money on ineffective programs. But so what's your comment on that?
Oh, I agree. I think the war on drugs has been going on since I was a kid. And I believe there's more problems with addicts and drugs today than there were when I was a kid. So I don't think that war is going in the people's favor that they thought it was. I think some people want to do drugs and will change their life course heading straight down to, well, till the end at some time, at many people do that, and it's their choice. I don't think the board or the county spending more money is ever going to stop that guy or that girl from doing that. I think we need to try, again, I go back to my other answer, is try and prevent it with the youth and steer them away from going down that path in the first place, as opposed to being reactionary and trying to stop everybody. I would like to just add one more thing, that I know a person who has their child is a diabetic, and this lady has to buy needles every day for her child. Every day she spends a lot of money on needles, every day, every month. It adds up. I don't think that it's fair that she should have to buy needles for addicts when she is the one who is taking care of a person who actually needs the needles, where the addicts are choosing to use. And I don't think that it's fair for somebody to pay for other people's needles when she gets no assistance for her own child in the needles.
Mary Jane, a follow-up?
Mike.
You're muted.
I am, yeah, I
There
am
you
muted.
go. There you go.
You don't hear me saying, oops, oops, oops. So I'm not going to follow up specifically on that, but I guess I'm interested in knowing from, are we still asking Kelly questions, Kelly? So as we look forward, I mean, we have covered frustration with how COVID was managed in our community and statewide and countrywide extensively. So I am looking forward to what we can look forward to in terms of public health in the future. You've talked about your ideas on prevention, which I think is a great notion, a great idea. It'd be interesting to see what the people who identify and work with that population what kind of recommendations they can come up with. But that's just one element of public health in our community. And again, as I mentioned earlier, we lose sight of the fact that the health department is concerned with a lot of other issues having to do with STDs and teen pregnancies. And you could, I think you can argue that STDs and teen pregnancy, whether that's a personal health issue or a public health issue. But our community has a lot of public health issues. And outside of focusing on prevention, I'm looking forward to the health department moving forward instead of continually looking backwards. That was my statement, I guess, not really a question.
Wait a minute, you had your time for answering questions.
Yeah.
I'm sorry. I'm sorry.
All right. Kelly, any questions you have for us?
No? The board? No? Chairman of the board shouldn't have questions about the board, I guess. At least I'm missing something.
Great. Thank you very much.
Thank you.
I'll turn the gavel back over to you,
Okay,
figuratively speaking,
put my hat
because I
back
think
on.
Margaret is up next.
Thank you for the interview. We are moving on to the next one. Margaret Lapik, sorry.
Right here in front. Yep.
Oh, hello. Welcome.
Thank you.
You've seen a little bit of it. We're asking questions of each candidate. What you just saw was a little weird one because I'm still up here. So sorry for any confusion, but thank you for coming and thank you for applying. So Commissioner Weber then, or, yeah. Oh, yes, pull the microphone and the green light is on.
Is that good? Okay.
Can you
Can you
speak?
hear me?
Yes, I can hear
Okay.
you. Thank you.
So first off, Margaret, it's good to see you again.
Thank
I
you.
want to thank you for the many, many years of wonderful service you give to this community through your work with ARC. It's been interesting as we've talked to an awful lot of applicants for a health job. Nobody has mentioned that kind of a disability challenge. We do have one.
Maybe that's because we've already done a lot to help them.
Well, that is true. So I just wanted to acknowledge your important role.
Thank you.
During COVID, there was a lot of controversy about the rules and regulations, the recommendations that came down, whether there should be mandates for this, that, and the other thing, whether schools and businesses should shut down, some shut down, others didn't have to shut down, and so on. The experts who made those recommendations always prefaced their comments with the idea that this was a new disease, we don't know everything about it, this is our best recommendation for keeping people as safe as possible. Now that some time has passed, what kind of learnings have you heard where we could do things differently the next time we have some kind of a pandemic?
I don't pretend to be an expert. I have no idea. I think we did do a lot of learning, and I presume that we have saved some of that data so that we can look at that data should another pandemic hit us again, and it will. But I would think that the real role of the health board would be to do some studying ahead of time to be prepared for the next pandemic, learning from our mistakes, but also learning from the things that we did well. And that's what I think the role of the health board should be, is to be prepared for the next time.
Thank you. Lindy? Micro.
Hello.
Hi,
It looks like you've worked with a diverse population
I have.
and a lot with children. Where would you be involved, do you think, or be most interested as far as the Board of Health and what you can do for children in our county, or
Well,
if you targeted them?
my work with people with disabilities isn't just with children, it's with children and adults. So I'm not exclusively focused on children. I'm really a community member. I've lived here for a long time, since 1963, I believe. And I have been involved with a number of other populations as well. I don't know whether your information about my application shows that I was working for the Health and Human Services Department for 12 years. And my role at that time was to implement mental health reform. So I've had a lot of experience in that arena as well. I also was a sponsor for I Have a Dream program in Cowlitz County, which is attending to the needs of young people who are living in poverty. So I kind of have a sprinkling of concerns about populations, but I wouldn't say that that's my focus. My focus is on solution finding for whatever problems do exist. Because I think it's our job, if we're if we're going around and we're being healthy and we're being well-fed and we're being satisfied with our life, then I think we need to give back.
So what program do you think you could initiate, or do you see any specific things that are lacking or missing in Cowlitz County related to the different diverse populations?
Well,
at
I
this-
think some of them I heard identified as I sat here and waited for my turn. The young people that are getting involved in drugs. I think that's a huge, huge issue. And maybe the programs that have already been implemented didn't work very well, but they sure learned some things from them. And why not try to get it to be a little bit better, to work a little harder, to find another way?
Do you feel comfortable looking into that as time goes on? Do you feel that would be a path you could take, as doing more
Yes,
than what we've done at this point?
yes.
Okay, thank you.
Thank you for your answers so far. You actually answered two of my questions, so I'm gonna go back to an older question. The CDC is advertising on television every night, or almost every night. All people over the age of 6 months are recommended to get vaccinated. Do you agree with that, being that young, and that all people should? With COVID-19, sorry.
Probably doesn't make any difference whether I agree with it or not. I think there's been a lot of controversy about the vaccines, and I don't pretend to be an expert, but I think there are people who are experts, and I think we should listen to them.
Unfortunately, the experts are conflicting, is what's happening.
But that's how you get to
Some of the
solutions.
experts.
That's how you get to solutions, is to listen to all sides and figure out what makes sense.
I like that idea, listening to all the sides. Rick, still not on, so back to Commissioner Mortensen.
I find these questions are sometimes hard to ask because there's always a presumption of some foundation. And in many cases, I don't agree with the assumptions. So for example, in a lot of these issues, I think we are complicit in the breakdown of the family, and that has so many downstream problems. So I try to step up and take a look. We've been, I think it's fair enough to say most of us are unhappy with the growth of health problems that we see. We spend and spend and spend, but the problems seem to grow. It's almost as if whatever we're spending on is growing the problem. Do you have any idea of what it is you might want to change to try and see, maybe we can really find out what the fundamental issue is?
I don't have any wisdom, if that's what you're asking, but I don't agree that we always have to spend money in order to solve a problem. So,
Could you begin again and more closely to the microphone?
sorry, I thought I was talking right into it. I don't think that we always have to spend money in order to solve a problem. There's other ways to approach problem solving than just spending money. And I don't agree with you particularly that we're spending money and we're getting worse. I think we're in a lot better situation right now. For instance, we're not in a pandemic, and we got through that.
That's at what price? I mean, there are people who, well, I'm not here to argue against you. I'm here to ask and see if you have a solution that we can embark upon. I do think you say something that it's not always the dollars, and I agree with you, and I think you've illustrated that your particular efforts and your dedication and volunteerism speaks quite highly, and I think we've come to the point where we've dehumanized interaction, everything's a check the box kind of thing, and you don't check the box. You go and talk to people, and
I do.
and I think therein maybe something. You mentioned experts. There, I feel we have to be very careful about experts. Do you?
Wow, that's an interesting question. I guess I think that we have to make sure that somebody that calls themselves an expert really has expertise.
We've been in the COVID arena, lots of conflicting things. I've been in academia more than about a half a dozen years, and I've learned that experts that can benefit from their programs are unreliable. And so I look at where somebody stands on something, and we don't seem to do that. You ask someone in mental health, what's the problem? Well, mental health is a problem. We've got to get more mental health people. It goes on and on like that.
I wouldn't answer that question that way. What's wrong with mental health? We're not delivering services correctly to solve the problem. That's what's wrong with mental health.
Can you give me a specific example?
I can give you an example that bothered me a great deal when I started working on mental health reform, and that was that the people who were delivering services were expecting the person with mental health to come to them rather than going out.
Okay, thank you. That would be Mary.
Yeah, Mary Jane, would you like to ask a question?
Absolutely. Margaret, can you talk about your definition of public health and how that intersects or doesn't intersect with personal health?
Gosh, that's a complicated question, Mary Jane. I'm not sure I can answer it.
I have confidence that you can
I guess,
answer.
to me, public health is something that someone or some group of people are doing that is negatively affecting a whole lot of other people, whereas personal health is something that you're basically dealing with yourself or within your own family rather than with the community. So that's the best way I can define it. Does that help?
Thank you for the answer. It's a good answer.
Thank you.
Commissioner Weber.
One priority that has been mentioned by other applicants, among other things, has been addressing substance abuse and homelessness. Excuse me. And of course, homeless oftentimes have multiple disabilities. It's one of the reasons that they can't figure out how to stay housed safely.
Right.
Can you talk to us a little bit about how we go about measuring the compassion side of things without enabling the behavior you're trying to change?
That's pretty complex.
Mhm.
I don't think you can help without having compassion. But I think if you're a true compassionate and helping person, you will quickly see that what you are doing is enabling if you're doing the wrong thing.
Kind of like a little bit on the tough love side. I mean, but
A
even
lot
that,
on the tough love side, yeah, a
Yeah.
lot. And I think you brought up homelessness, and I guess I'm a little surprised that that's kind of a public health issue as much as it is a community-wide issue. It affects everything. It affects all kinds of people in all kinds of ways. And, you know, it's a very, very complex issue because there's so many reasons why somebody might be homeless. And they vary so much that certain programs are right for certain homeless people and certain other things are never gonna work for a homeless person.
So I'm supposing because those who are chronically homeless have the most difficult time getting housed is because they have the combination of mental health and substance abuse issues
And other
and
issues.
physical and other
other
physical
issues, yes.
issues. So. you know,
Age being one of them.
Thank you. Appreciate that.
Thank you very much. Lindy, you already went? Yeah. Do you have any questions for the board or for anybody?
I
Yes.
guess my question is, when are you gonna decide?
Next week, Tuesday at 10 o'clock is the vote for a recommendation, but then it gets kicked over to the Board of Commissioners to decide. So we're scheduled at least between me and the clerk to have everybody done before the next meeting,
For
which
the
is a
next
month.
meeting?
Right.
Okay, thank you.
And we could swear in new people then.
Okay, well, I would like to close by commending the people that have been on the health board already. I've been aware of them for a long, long time, and I was very aware of them when I was working for Health and Human Services. But I think that's a great volunteer activity, and I hope you'll give me a chance to participate.
Thank you very much. Not too often do we get a compliment, so I appreciate that. Thank you. Thank you for your time and for coming. Okay, so we're taking the schedule pretty well, actually a little bit ahead of a schedule. Next person we have is, or I think this is the last person we have today. Theodore Gramont.
Mr. Chairman, do we have others after Theodore?
Have what?
You said last one for today. Do we have a tomorrow?
No, I think this is the last one.
Okay, thank you.
That we had, there was some changes this morning happened.
Yeah.
So Theodore Gramont. I think Kelly's sending the code to unlock them.
Oh, yes. Yes, I'm sorry. Yes. I think so.
I'd just like to say thank you to your patience. Some of you have been here since this morning. Okay, we'll give them a couple more minutes. Take a 5-minute break. We'll take a 5-minute recess.
for your own edification, which is perfectly good. We haven't seen you at any of the Board of Health meetings, have we?
Any of the what?
We haven't seen you at any of these board meetings before.
No. But I was on the homeless coalition and, before the homeless coalition was ended, that's where we were meeting, was at the health department, the county health department.
The Homeless Housing Task Force still meets there. In fact, they're meeting again on Thursday, I think. He might know. Or are you still on the board? Nope. He doesn't know. Okay.
Thank you. Mary Jane, would you like to ask a question?
Sure. Can you tell me what your definition of public health is?
My definition of public health is basically I'm not really, I guess I'm really not understanding. I guess I'm not prepared for that. I was just looking for,
So what issues do you see as important topics that the Board of Health would tackle?
I guess I should state this. I see a lot of health issues in the community because, I've been serving the homeless for 10 years now. July 5th was our 10-year anniversary for the Victoria Freeman Park Project. We've been serving that 10 years, and I've seen a lot of the issues that we see in the community with the homeless, for the mental illness, and for the health issues, and I've seen. I deal with a lot of that. That's part of my job as a co-founder of that project. I do the security there, and I deal with a lot of the illness, the mental illnesses there, I know that's not really necessarily what you're looking for, but I just think that I wish we would address. I'm not sure if that's part of the Board of Health, but I think that's part of the issues that we have in this community that we need to address as a health issue, is our mental illness that's not being addressed.
Thank you.
Commissioner Weber.
So you mentioned that you've been involved with being homeless yourself.
Yes, I've been homeless.
As well as being very involved with a food program. Okay. In your opinion, what is the most effective strategy for addressing homelessness in the community?
I think there's a variety of different ways to look and to address the homeless issue in the community. Is I think that I think one size fits all does not work. That project does not work. We need to address several different issues, and we need to have smaller groups. I know that doesn't work because the community doesn't want them all over the neighborhood and all over, but I think that we need to have smaller different groups. And the homeless, and you have your people that want to do the drugs, and you have the people, the families, and then you have the ones that are, and so we can address, and then you have the people with mental illness, and just to be able to address every different issue instead of have everybody all compiled in one room and expect to, because we all know one size fits all does not fit anywhere in society. Because we all come from different backgrounds, different beliefs, and different,
So we have, as you mentioned, quite a few different programs that help different types of homelessness. But there seemed to be a group, a relatively small group, that just doesn't fit in anywhere.
I've been off the streets since December 2011.
Okay.
And I'd say there's probably at least 10 or 11 people that were on the streets since I've been, they're still currently, I know we call them chronically homeless, but they're still currently on the streets since I've been off the streets. And I see that we've never I've tried to help them over the years. I've tried to figure out ways, but around on, and a lot of that is mental illness. It's not necessarily that they don't want help. It's just they're not getting, the illness, the mental illness is not being addressed, or or maybe it's a variety of different reasons, but those issues aren't being addressed. And like I said, it might be a combination of the mental health department, and it might be a combination of the person itself.
So if the government, if the county government makes the treatment available, how do we get folks who
Yeah, that's kind of,
don't want the help?
that's
Take it.
kind of like, that you can't, I know you can't force people to the mental illness, and you can't force people to take the medication if the medication is the issue, or if it's counseling. I mean, because I deal with depression. I understand that, so I understand the issue of depression and and all that stuff. It's one of those give and takes. I'm not sure how do we address to get to the people to get the help that don't want the help.
What have you heard about Hope Village? Is it worked or is it not working?
I've heard it's worked. I've seen some good things. I mean, I do notice that our homeless population, some of it has gone down, but it has expanded in some ways too, because we're starting to see a lot of elderly people coming out on the streets. I mean, the last 3 months, I've seen more people in wheelchairs and walkers, and people are, I'd say, in their 60s, 70s, maybe older. I've never haven't had a chance to talk to them, because they just come and go, and they don't stick around. I sit down and try to talk to everybody who shows up, and try to find out a little bit what they're willing to share, and try to help them where I can, and give them some of the education. Like I said, that's part of I just like to help, and I just like to be involved in as much as I can. And I was just diagnosed with cancer last week, so I'm not sure where I stand right now, but I'm hoping that I'm going to be around forever.
Well, thank you for the food program that you've been working on for all these years. I know that makes a difference in some people's lives.
I mean, I know that there's a big portion, there's a majority of our population in this community seems to think that by feeding people, we're hindering people. I don't think we're hindering people. I think that I've been on the streets where we didn't have feeding programs, and you had to find ways to feed yourself. I think giving somebody, at least if they don't have a place to sleep, giving somebody a full belly makes a big difference in somebody's lives. I think that 3 needs that we need to address is showers, clean clothing, and a place to sleep, and all our basic needs. And I know that as a community, we can't address everything, but I think that we need to figure out a way to. What the answer to that is, I don't know.
Well, thank you for what you are able to do. Appreciate it.
Well, thank you. I'm glad. It's my pleasure.
Lindy?
Hi, hello, I'm
Hello.
Lindy Campbell. I have a couple of questions for you, and I really am sincere about this. If you were in charge of a program, could you outline how that would look to get the homeless off the streets and into a safe place? And that's number one, but number two, I want to go to number 2 first. How do you feel about people laying on the street and just being left there versus a little bus coming around, picking them up and taking them to a safe location against their will, probably, until they sobered up or did something to where they could be
So
communicating?
I think your number 2 question is absolutely I think that I like that idea. I think that leaving people on the streets is not the right idea. I don't know that, I like the idea of putting them in a bus and putting them somewhere and giving them a safe place to stay, and be able to figure out how to help to address those issues. If there's ways to work on how to address the issues with the mental illness and alcohol and drugs. I mean, somebody told me one time that they said, because I was working for an agency and they said, and it was in a church and they said, well, why don't you force religion on them? He said, look, he said, if you get people, you know, you help people with being homeless and you have church on the other side of the wall there. He said, eventually people are going to go in there instead of forcing them. Let them hear that and they'll go to God within time. There's no reason to try to. I mean, I know I'm not saying, but I hope you understand what I'm saying. And I think that if people start to see people getting help and people making changes, and we start addressing some of those issues, I think that we're not going to get everybody, but we're going to get some of those people to want to go to those programs. And I think having mentors, somebody has been there, done that, help them walk that way. Because I know there's a perfect guy that was on the streets. He'd been on the streets forever, for a long time. And I shook my head. I thought this guy would never, ever get help. This man has graduated from college. He's got several degrees. He's working. He's got housing. He's been housed for a long time. He's driving a car. I mean, if you'd seen this guy when he was homeless and you see him now, you'd be amazed. I mean, I know that watching this guy, what he's been through, anything is possible.
You know, and so then as far as a plan, would you feel like you could actually create a plan that you could show someone what you might think would work for a county or a city or whatever?
I could come up with some ideas. I wouldn't have a complete plan, but I have some ideas that I mean, me and my friend Bob that passed away in May, we had an idea when you guys were looking at campsites that was our point was putting smaller, instead of one large facility and having everybody in a large facility, having smaller facilities.
Okay.
And, you know, and being able to, because it's much easier to address some of the issues in smaller facilities than it is for a larger facility. Just like a classroom. If you take a classroom and you take a whole large classroom full of kids, you're not going to be able to educate all those kids. Most of the kids aren't going to get educated because the kids around them that don't want to learn are going to affect the kids that are having the learning disabilities. Same thing with a large facility, a homeless population. The ones that need the help the most are less likely to get the help the least.
Do we have a committee from the county that works with people that could come and just talk about that? Has that already been done 1,000 times over? And
I think we have a homeless task force, I believe.
you're not on the homeless task force.
No, I
anymore.
applied for it when it first started, but I I'm not sure what, and I didn't get on the.
If HHS has,
If it's within the normal hour, business hours, HHS, people walk in and say, can you help me?
I'm sorry, I didn't mean to turn this into a home, I mean.
No, I want to know because it's a problem for us. So you sound like you have a lot of experience personally, in my opinion.
I've honestly spent most of my adult life, except since 2011, I've been knock on wood, I've been off the street since 2011. And that's, my goal was to help get back and try to help as many people and try to help educate the community. Because I think, and I'm going to say this one thing, I should, if you take somebody that's been on the streets 6 months or longer, they now become a prisoner in their own mind. Because everything you're taught as a kid, you forget all that stuff. Because none of that matters. It's a matter of a survival of the fittest. You're now a prisoner in your own mind because now you're trying to survive, trying to figure out where next place you're going to sleep, the next place you're going to eat, the next place you're going to change your clothes, the next place, all the basic needs that we take advantage of every day that we're able to have because we have housing. These people now have to try to figure out how to address those needs every day. That's why I say they're a prisoner in their own mind.
Well, thank you for that information. I really appreciate it.
I mean, I hope that makes sense. I mean,
Perfect sense. Yes. Probably the best I've heard all day. Thank you.
So aside from homelessness, because, yeah, we see it's a big problem, would you put that as a first priority? If you were appointed to the Board of Health, would you think that that's a first priority for the Board of Health? Or what would you think?
I think, my personal opinion, I mean, I think mental illness should be the first priority of the Board of Health, because I think that's a big problem in this community, whether it's homelessness or it's people in housing is I think that we need, because you see it all over the country that we're not addressing, mental illness is not being, my opinion, is not being addressed. And I don't know why that is. I'm not an expert. You know, I don't think that that's being addressed like it should be addressed as well as it should be addressed. What the answer to that is, I don't have an answer to that, but I wish I did. I mean, I'm obviously not a mental health expert, so I can't say that. I mean,
That was gonna be my follow-up question, of what to do, but I can't answer it either. It's a tough question, what to do.
I mean, I think the only ones that would have the answer would be an expert in the field, and somebody that knows how to do it. And I mean, I mean, I tell people, you know, that when people come to the park and they say, well, what about these people? I said, look, you know, out of the 10 years we've been running this program, we'd never had to call the cops. We'd never had to call emergency services. I'd never had, why? Because anytime somebody starts getting out of hand, I get up, they stop. They know that I have to come talk to them. They know that I mean business, and there is no ifs, ands, or buts, and it gets addressed right then and there. I mean, I'm not saying that I'm perfect, but most people know that if I have to get up and, you know, get up from what I'm doing, that I'm not gonna, you know, I mean, like I said, I'm not perfect. I'm not an expert at anything, but I mean, I've run this program 10 years. I've never had to have the cops, never. And I know the city knows we're there because they send people there, but they've never had to come out and say, hey, you know, we don't want you here. Because we always leave the park cleaner than it was when we got there.
And I wish everybody would do that.
I mean, because I respect our neighbors, and I respect the city, and I respect the county that we live in. I think that like I said, that's why I love volunteering, because I want to help. I want to help make our community better and a stronger place. And how do we do that? We try to help address the issues that need to be addressed.
And I can see that in your testimony today. We're about out of time. Do you have any questions for us? It's not mandatory.
No, not that. I mean, I hope that I didn't ramble on about homelessness. I hope that.
Well, still got 32 seconds if you want.
No, I just think that I would hope that I get appointed to this board, because I would like to help. I would like to try to help the community in different aspects that I'm already not already helping. I think that with my experience, I think I can add a different variety to it.
And either way, even if you don't get an appointment, like I think Commissioner Mortensen said, we haven't seen you before, but it sounds like you've got a lot of you've got a lot of good ideas, and we recognize as a board that homelessness is part of a health problem. And so we'd like to see you back.
When is the health board meeting?
Every month, last Tuesday of the month at 10 o'clock.
At 10 o'clock? Okay, I will start coming then.
Yeah, we'd like your input.
Thank you very much, and I appreciate your time.
Thank you for coming, and thank you for your time.
Thank you. You guys have a good day.
You too. Have a good day. So that's our last interview for today.
Our last interview.
Yeah, last interview period. Yeah, period. Two things to close out. First of all, I talked to the clerk, and we had talked about doing a paper ballot for each voting member. Does that sound okay to you? Category, 3 categories, and every board member will just mark their ballot as a paper ballot and pass it on, as opposed to me trying to remember who voted for every name. Does paper ballot sound okay to you?
Well, Kelly, I'm a bit conflicted about getting 2 votes.
No, you could only.
Because not only am I a member of this board, but I'm on the Board of Commissioners. And it seems like we will be deciding who the next health board members are when we find out how we vote on this board. And I'm not comfortable in doing that. So at this point, I think I'm gonna abstain and let the non-electeds really give us their recommendations. Otherwise, it's like we're voting twice, and that doesn't make sense to me. So if you're comfortable with the paper ballot, I'll support you.
The paper just for ease is what I was thinking. But you bring up a good point.
Well, I would argue somewhat against that point. We all have to learn how to wear different hats in different circumstances. So when we're on the board of the Three Rivers wastewater, we represent more than just some narrow county interest. But also on this board, it's the commissioners, the BOCC has the ultimate say on who gets on. So that ultimate say includes, we don't like the recommendation of the Board of Health,
Yeah.
and we're going to overrule that. So the power is in the Board of County Commissioners' hand anyhow. So if we, I think the more public we are with
To
that.
vote for recommendation.
So I'm not too concerned over that.
Okay, so we'll go paper ballots, and yeah, I think we should vote. We should all vote.
Well, when you
Um,
say paper ballots, are you saying it's a secret ballot?
No, I don't think anything's secret. We can't do any secrets here. No, just only for tallying the votes, and I guess I turn in the papers to the clerk, so no secrets. Unless you think that should be.
I don't think we can do a secret ballot.
Yeah,
That's not
I'm
one of
sorry?
the options.
can't do secret ballots. Yeah, that's what I was thinking, and then.
Yeah, take that sheet and
right.
put a circle around.
Yeah. Correct.
Are we going to, yeah, we should talk a little bit on the mechanics too.
Like,
I've been contacted by enough of the public that says they want to have some comment or feedback into this.
I think next week would be good for that. So next week will be, the only item on the agenda is to vote for recommendation. And at that point, we can open it for discussion on the board and possibly talk about different candidates, and then open it to the public, and then take the vote for a recommendation. And again, the vote is just going to the commissioners, and the commissioners are going to vote again. So would that be a good time to open it up?
When do you see the public being able to?
Next
speak?
week,
Right, when in the process next week? So do
I would say probably before we take the vote. I think we can kind of do a quick discussion, review, ask any questions that we might have amongst ourselves, then open it to the public, and then take a paper vote. If that
Okay.
sounds fair. No, I'm just saying discussion. Discussion. So we'll work with that. Bailey wanted me to make sure I ask if the paper ballots is okay, and then she can work on some with you. And then the last thing I wanted to say,
But Kelly, I think paper ballot typically means an anonymous vote is cast, but that can't happen because it's a public meeting. So our names have to be on the ballots.
Exactly.
So everybody knows
Yes,
how everybody
yes.
voted.
That's what,
Yeah,
that's what I say.
okay.
It would be
Okay.
this, basically this with each of our names on it. On safe paper. And then the last thing I'd like to say, I'd just like to thank all the old board members, not saying that you're old, but the board members, myself and Lindy and Mary Jane, we've been held over for the last almost 2 months now. So I just like to say thank you for hanging in there, and for the public also for bearing with us while we go through this process. We have to be transparent, and government is very slow, and these things are taking a lot longer than I ever thought. But once we're finished, I hope we can get back to regular Board of Health business. And I just want to thank you for the extra time, especially today. This is the longest meeting we've ever had. And
Not for me or for Dennis.
no, you guys are seasoned pros on that old,
Mm.
long meetings, but for us rookies, it's
You
tough.
know, for those who are aspiring to replace us, I hope they realize they have to go through a surgical process.
I'm not gonna ask which one. So with that, clerk, anything? Kelly? Okay, well, we'll adjourn the meeting at 2:33. Thank you very much for coming and your patience.
Thank you.